to have a healthy body and a healthy mind, one of the important aspects is sleep. In today's busy days, sleep is one of the aspects which is most neglected. I would like to discuss a particular aspect of sleep which is affecting a large number of population. Few of my patients or sometimes their relatives come to me about snoring. Well, what is snoring? Snoring is a sound that is produced when air travels through a narrow area, causing fluttering or movement of the tissues around it. We know that when we breathe, the air travels through the nose, through the back of the nose, to the larynx and then to lungs. So there are some areas in this anatomy which may be compromised or may be narrow in few people. So once those areas are narrow, the structures fall and cause a sound which is snoring. Well, snoring is a social issue. People who snore create problems for the people who are sleeping along with them. But there's one more aspect, a medical aspect of snoring called sleep apnea or obstructive sleep apnea. So whenever air travels through a narrow area, it can cause collapse of that area where there are collapsible structures, leading to narrowing and collapse of the structure. So first the patient may have snoring for some time and suddenly the patient goes into a state of no snoring and almost no breathing. So when there is no snoring and no breathing happening for about 10 seconds, we consider it to be a spell of apnea. That is no breathing at all. So what happens to the individual during this time? Normally a person is relaxed, is in deep sleep and his blood pressure is normal or reduced. His heart rate is at a low level because he is relaxed and his oxygenation is 100%. During these few seconds of apnea, the oxygenation keeps falling down from 100% to 90, 80 and down. And as the oxygenation reduces, the brain gets less of oxygen. So what the body does is to produce more. So the heart keeps on increasing, the heart rate increases. So from 60 to 70 beats per minute, it goes to 90, 120, 140. So you can understand that to reach a target of 140 beats heart rate on a treadmill, you really need to exercise. But here it's happening during sleep and the individual does not even know. So at a particular time, as the oxygenation comes down, the brain gives a wake-up call. The wake-up call is bringing the person up from deep sleep to upper level of sleep. There's a sudden movement by the patient and then that causes contraction of the muscles and the airway opens. And the patient again or the individual again goes back to snoring. This cycle can happen many times during the night. Many people may have so many apneic episodes per hour. So you can understand that what is the effect of each of these apneic episodes or these short stoppages that's happening to the body. Well, if I would like to talk about symptoms of what would happen during a patient's obstructive sleep apnea, these people usually have morning headaches, do not feel comfortable or do not feel complete after the whole night of sleep. They may sleep for 8 hours, but they get up and they still feel tired. You must have noticed few people who during a presentation or on the waiting room, within a few minutes of sitting down there, they fall asleep. So excessive daytime sleepiness. This is another symptom of having obstructive sleep apnea. There are multiple other symptoms affecting the social aspect of the individual. Other than these aspects, there's something which are more severe, like as I told you, it's affecting the heart, the blood pressure and other organs. So the heart, instead of taking rest during the night, is actually going overboard and actually doing more work than normal. So we have seen young people coming with hypertension, not being able to manage even with medication. The effects are due to the effects on the heart. So an obstructive sleep apnea is a medical condition, whereas snoring is more of a social problem. So you would ask me, how do you understand or differentiate between this obstructive sleep apnea and snoring? Many people snore. So all the people who snore may not have obstructive sleep apnea. They may snore for a few hours in the day or a few hours in the night and may not snore after that. But there are many who may be having obstructive symptoms. A visit to your doctor, an ENT doctor, to evaluate these, he would definitely go through a fiber optics endoscopy to evaluate areas which are narrow. The most common areas that get narrow among the Indian population is the area called the soft palate, or the back of the nose as the air travels. The soft palate, usually that area behind the soft palate is narrow, causing contraction in that area and fluttering of the soft palate, causing snoring. So once the endoscopic evaluation is done, one of the gold standard tests to identify between snoring and an obstructive sleep apnea is a sleep study. There are various methods of performing sleep study. There are simple tests nowadays available in a watch, in many of your watches, where they do some sleep tests. Then there are home tests that are available, and there are definitely institutional tests which are done as sleep study, complete sleep study is performed. The ones with the watch or the home are slightly more of a screening studies, but the institutional has more studies and more parameters that are evaluated. How much of hypoventilation, reduced saturation, heart rate, etc. And when we see a patient with these kind of symptoms and having severe obstructive sleep apnea, we do counsel them on further treatment. So what is the treatment of obstructive sleep apnea? Obstructive sleep apnea can be treated medically and also surgically. The medical management involves use of a machine, the CPAP machine or the BiPAP machine. So it's a machine which continuously gives positive airway pressure. The individual wears a mask, tight mask, and sleeps. So the airway pressure being continuous through the nose keeps the nose and the airway open. So it's a way of getting through this process by using a machine. The surgical process includes dilating or opening up of those areas which are narrow, which may include some part of the nasal septum, maybe the soft palate, which is called the palatoplasty. The tonsils are removed. The area, the cross-sectional area is actually widened. So understanding this concept, whether it's a snoring or an obstructive sleep apnea, is very important. With the present lifestyle, a lot of sedentary sitting and working, gain in weight has led to a lot of people with snoring and definitely sleep apnea. Weight loss is one of the main factors that should be kept in mind while treating sleep apnea, and individuals, whether going for a medical treatment or a surgical management, should undergo weight loss.